Recently, a relative got a root canal done and she had a large swelling. Does that mean that root canal is harmful for you? Hi everyone, welcome back to my channel. So today, what are we going to talk about? You must have seen recently in your news channels that somebody got a very large swelling because of doing a root canal. Do you think that's right? Do you think that every other person who gets a root canal done, which is one of the most commonest of this treatment plan, everybody develops a swelling? Does the swelling mean that it's an indication that root canal is harmful for you and you should not be doing it? Let's check out. Now, when does your dentist advise you to get a root canal done? Whenever you have a decay which has crossed that level of filling, where you can, do just a restoration and get it filled, that's one of the easiest way. But whenever it has crossed that and your decay has proceeded so much ahead that it is affecting the nerve or the pulp tissue of the tooth, then there is no other way other than doing a root canal. If you do a root canal, you can save your tooth. That's why they advise you to do that. Also, even if you have a large decay, there might be pus formation, as in there might be an infection in the tooth. In that case also, a root canal is advised. If you don't get a root canal done, it's not just for the pain that you do it, it is for saving your natural tooth. If you leave it for a very long time, then what happens is at the end of the day, you will have to get the tooth removed. Sometimes a swelling can be associated with the tooth. It can be before the root canal treatment, at times it may be after the root canal treatment. Now let's see when does that happen. Whenever there is no infection and the teeth is just having pain, sometimes no pain at all, and it's just sensitive to cold items, but still a root canal is advised for the tooth. That is a very ideal condition, and in those kind of cases, 90 to 95% or maybe more than that, the success rate of the root canal is very high. Those patients, we can do a root canal within just a single sitting. In a single day, it can be finished. But that's not the case with patients who have a small swelling before the root canal. A swelling indicates that there is an infection which is present at the apex of the root. The entire tooth is infected with a lot of bacteria which needs to be cleaned and removed from the canal. Whereas, in case of an infected tooth, we should never do a root canal in a single sitting, because how much ever we try to prepare the canal, we will not be able to remove the dead and decaying matter, the bacteria. We cannot completely clean it. What we do at that time is we need to definitely open up the canal, remove the dead and the decaying bacteria which is present inside, as well as we give the patient some antibiotic along with the painkiller. And after cleaning up the canal, it needs to be left open, maybe not a completely open one. We need to cover it with some medication like calcium hydroxide inside the canal, which helps in remineralization and removal of the dead bacteria. So we place it inside the canal, leave it with a slight open dressing. What I mean is we don't completely cover it with a closed cement, like how we do it in case of a filling. Then repeatedly for a couple of days, maybe for up to 2 weeks, we need to leave the calcium hydroxide inside, and then repeatedly we recall the patient in order to check whether there is any infection still left. We do a cleaning of the canal on a repeated basis using some certain chemicals which are indicated for oral use. So it can be sodium hypochlorite, chlorhexidine, and even normal saline. Most of the dentists, they prefer using normal saline along with a little bit of either of these ingredients. So what we are trying to do is whenever there is an infection, so an infection inside the canal, you can just imagine that you imagine 4 walls around you and there is some water inside, which is whatever it is, it's completely packed and it's not able to escape out from that area. So that is what happens in case of an infection in terms of a tooth. So the tooth has a root, and at the tip of the root, it's a closed space, right? So there is this very small, tiny little foramen present there. And whenever the infection has crossed the limit of the tooth, it starts extending. Whenever there is a pressure buildup and it's not able to go out, what happens is it starts going out from that area into the tissue spaces. Now, it can be over next adjacent to the tooth, the adjacent bone area, gum tissue, and if possible, if the infection is so large, it can even go into facial spaces. These are the reasons for swelling in case of a root canal. So if you don't do a treatment, you can still develop a swelling if the pressure inside is high and the bacteria is so active. At the same time, if you do a root canal, still you can develop this. What we need to understand here is that the tissue response of the patient, it's not the same in each case. So whenever there is an infection which is already present, the mistake that can happen from a dentist side is that they might close the canal which is already infected. But I don't think that any dentist would do that. They will always try to leave and some medicament inside for a couple of days just to feel that in case there's a swelling present before that comes down, the antibiotic treatment is given and the patient is comfortable before completing the root canal treatment. So that's one of the reasons which can happen. Another reason for which there can be a swelling after the root canal is we use certain medicaments or certain materials for irrigation. They are chemicals and they need to be, when you're using that, the dentist is very careful that it does not expel out. I mean, it does not expel out of the tooth. It should not be crossing apex. So what happens is at times, when we inject those liquids inside in order to do the cleaning and shaping, sometimes a little bit of fluid escapes into the tissue spaces, which in turn can cause a tissue reaction and lead to swelling. Now, generally, when do you get a swelling? Whenever there is an injury, the tissue fluid starts expelling out. And the irony is that when you get a swelling in your leg or your hand because of an injury, you are not so scared of it. But when you have a similar thing on your face, it looks, because you can see it in yourself and you actually get that fear of like something is very much wrong with me. Whenever the infection is very large and if in case by chance the patient has a very large swelling before or after, still there are treatment plans where you can do the incision and drainage of that area and make it all. There is nothing to worry. And whenever you have a very tiny little infection which can be seen in the radiograph, what we generally would be doing is to clean the canals, leave it open so that the pus can drain out, and then you can actually refill the canal with the intracanal medicament, keep it for 2 to 3 weeks, see if everything is fine, and that's when we do a completion of the root canal. Despite all the measures taken, sometimes there can be an endodontic flare-up which can occur in certain patients, even though everything is done properly. A slight over instrumentation, as in crossing the apex of the root, or maybe at times, a little bit of bacteria might be left out, which leads to a flare up in the second stage of your treatment. So this can happen during the treatment as well. Like you do start the treatment on one day, everything is fine. Maybe after 3 days, you might develop a swelling. That's just a flare up reaction. It can be a reaction to the body, or it can also be a reaction because of the bacteria which are present. But there is nothing to worry throughout the treatment. Whenever there is at the apex of the root, if there is something which is extending over there, it's just the tissue response that happens. And sometimes some patients are also slightly more sensitive than others, and leading to these chemicals which we use for the cleaning of the canals can also cause a little bit of tissue response from their side. So having a small flare-up reaction is very common. It's not at all something to worry about. In a milder way, it is common, but sometimes certain patients do develop a very large swelling which needs to be taken care of in that way. We give a much stronger antibiotic for such patients, including the painkiller. See, swelling on the face is not something which might just drastically reduce in one day. If you get that swelling, then you need to wait for a couple of days for it to come down. And sometimes, that person is kind of unlucky, I should say, because what happens is just because one patient had this problem does not mean that every other person who does a root canal is going to end up like this. That's not the case. Having a swelling is very common. You come to a dental clinic and you check out of so many patients who do a root canal, some of them do develop a swelling. So that's not an indication that whenever you need to do it, if you want to save your tooth, you have to get a root canal done. Just anticipate slight amount of pain. Sometimes for some patients, slight amount of swelling. This has to be anticipated, and that is not at all a contraindication for the treatment. A root canal is one of the best treatments which needs to be done if you want to save your tooth. And saving your natural tooth is much important and much better because it is more long lasting than any of the artificial ways of doing a treatment. Root canal is not a new treatment. It has been done since ages in our country, in all the other countries as well. So that's one of the gold standard treatment that needs to be done. So just what you need to do is, whenever you are advised to get it done, go to a good dentist in a good dental clinic and you can definitely get it done. As well as you need to understand that you cannot compare yourself with another patient, your relative or your friend who has got it done in just one day. I've seen a lot of patients coming and asking that my friend got it done in one day. Why is my root canal not done in one day? Why do I need to come so many times for the treatment? That depends on the kind of tooth. Maybe you have a dead tooth which is completely, infected with bacteria. Doing that in a single sitting is not at all advised, and that will never be a good treatment for you as well. So what you need to understand is just don't compare yourself. Your treatment protocol might be entirely different based on your condition, your tooth preparation, everything. There are so many other factors which it depends upon. So root canal is never a contraindication, and don't be scared. Just get it done from a good place. Everything would be good. So that's all for today. Please like, share and subscribe my channel and follow for more information or easy information regarding the tooth and other adjacent structures. Thank you.